To get snowboarding here and build some snowmen already. All right, well, there's never a better time to get a new smile than in the new year, right? And joining us today to talk about porcelain veneers are our good friends, Dr. John Heimke from the Facial Aesthetics Designers, Pinhas Adar, who is an oral design master ceramist in Atlanta, and their very happy client, Shannon. Welcome all three of you to the show.
Thank you. Thank you.
So for those who don't know what porcelain veneers are, can you explain that to us?
Yeah, porcelain veneer is a thin shell of porcelain, similar, if you think of it like a fake fingernail, it's kind of like that, but it's a little more involved. But basically, we design the shape of them, and we have control of color and shape, and then we place them onto the teeth. We actually bond them on.
They're bonded onto the teeth.
Bonded on.
Okay, so who would be a good candidate for this?
Well, really, most people I've done 13 to 95 years of age, and really it depends on someone that just doesn't like their smile, and we evaluate it, and we determine, are we going to need some ortho, or are we just going to go right to veneers? A lot of times they want to change shape and color, and so we can do that all in one, about 2 appointments, basically.
This sounds like a hard thing to do, and Pinhas, you're the big mind behind this. What kind of challenges do you have when creating these?
Well, in any dental endeavor, it's always a perception and interpretation. So the biggest thing in anything, even including veneers, is the vision. You have to have a vision for outcome before you start. So that's how we did with Shannon, actually, who flew from Hawaii. We created a vision of blueprint to create a popping smile, and Dr. John actually trimmed the temporary, and that's what you'll see later. But the thing is the communication of what patient wants, right? That's the biggest key.
Right.
Because everybody can claim things about ceramic, but it's actually execution, delivering what patient wants. Not what we think it should be, but what the patient wants, and that's the key.
Well, and I think every patient wants their teeth to look natural, and I think every time you guys come on and you show these pictures and these videos, what you do, it just looks so, it really does look natural.
Yeah.
So I guess my question for Shannon is, the gorgeous, beautiful Shannon, what made you decide to get veneers?
You know, I just wasn't feeling 100% confident with my smile.
Okay.
And it took several years and a little bit of lots of research to find the absolute best of the best. And, you know, it's a big change you're making to yourself when you change your smile and want to enhance it. And after years, like I said, of waiting and finding the right people, Adar and Dr. John Heimke were an absolute perfect fit for me. I mean, I flew all the way from Honolulu to be here, so that speaks volumes, I think.
It does.
Just having the virtual experience with them on the phone, the FaceTimes, I felt more comfortable with these two explaining the procedures to me and explaining what needs to be done, and actually felt like a connection with them, you know, all the way on the phone, Honolulu to Cleveland.
Okay, and sorry, this is your before picture.
That's the before picture.
Yes.
All right, and then we'll have the after
temporary,
one. Still looking beautiful, of course.
And this is the design. We actually were on FaceTime, and she actually watched me do this, and I asked him questions. Together. Exactly. See, you know, in my laboratory in Atlanta, that's how we do it. We can communicate with the patient directly. She's in Hawaii.
Over the phone we did it.
And it was amazing because she knew exactly what I was talking about. I asked the right questions, and I think that's the key to clarify the vision before we do it. And then we printed the model, 3D model right here, that's before, and then we also printed the popping smile with silicone, where Dr. John actually used it as a starting point to see how it looks, this vision, in her mouth, because we don't know until we put it in the mouth.
And then I put it in the mouth, and then I sculpt it. So I call it making the teeth come alive. Because Pinhas gets me to this point, and then when I put it in the mouth, I'm actually seeing it 3D in their actual, on their actual teeth. And then like an artist takes a brush or a sculptor takes a sculpting knife, I use my dental handpiece and I actually sculpt the teeth to fit their face and customize it right there in the chair. It takes only about 15-20 minutes to do that part. And the whole appointment's only about an hour and a half or so. And then there's a second appointment to deliver the veneers like we're going to do next week. But the change happened all in about an hour and a half. And as you can see with the gorgeous smile.
Gorgeous. And so she's got her prototypes in now.
Yes.
That's the crazy part. These are just the prototypes.
Yesterday, amazing.
And then she'll get the real things put in.
Next week.
Wow. I'm sure they're not called the real things, but
the ceramic veneers. But then she saw the opportunity today. I talked to her about little samples. I made custom shades for her. How white is white, how natural is natural, and that's the key. So she selected by asking the right question, what was she comfort level as far as how white she wants to be, and that's how we do it.
How successful has this been for you? How has this changed your life?
I mean, so far, I even since, you know, I almost feel like right away it did. I just feel like it's given me more confidence even since, you know, we started talking about it, I was like, wow, this is going to really change my life, because I was, not smiling with a full smile every day. And that's a big deal.
It is.
The smile is a big deal. It's the center of your face. You want to look
Shannon, you walked into the studio and you smiled at me and you just lit up, honestly, really. And that's by the help of these wonderful men here.
Yes, they are both amazing.
And it's a joy every day to do this. I mean, people have a lot of fears of dentistry and things like that. But, how many times do people go to the dentist and say, this was fantastic, and the next day they're vibrant, they're able to do things, and they actually change. You can see that physical change occur, and that's what we love to do. That's what Pinhas and I love to do. When we collaborate, it's very important. We collaborate as a team. We do it with our specialists. When we do implant cases, we're using digital smile design, as you know. We're using video. We're using intro. We used a scanner today, and we made models of her provisionals, and then we sent them within minutes to his lab in Atlanta. So when he goes back tonight, it's already there.
You guys are real teeth artists. I don't know if that's a thing, but it is. It's an art.
Together.
It's fun.
You guys are awesome. Shannon, you look beautiful.
Thank you.
If you at home would like more information, you can go to everyonelovesmysmile.com. Thank you again so much. Merry Christmas to you.
Thank you.
Merry Christmas.
Smile big all Christmas long, right?
Yes. Thank you.
Okay, coming up next on Live on Lakeside, Arlene Goldberg is here with a very hot travel deal you won't want to miss. Today's travel trivia question is, what cruise ship has a magic carpet? The answer is coming up. Stay tuned.
This segment of Live on Lakeside was sponsored by the Facial Aesthetic Designers.